all heard about the Jamaica Logistics Hub and making Jamaica the fourth major node in the global logistics chain. But what does all of this mean, and how will it affect you? We have the answers in today's show. Hi, I'm Adrian Atkinson. Welcome to another informative edition of Jamaica Magazine. On the pages, as mentioned earlier, leveraging the power of speed and connectivity. Also in the half hour, as promised last week, Minister of Health Dr. Fenton Ferguson is back on issues, answering those critical questions about the sector he manages, plus entertainment and so much more right now. Logistics, trade facilitation network, highly sophisticated workforce, manufacturing and shipping. Those are the components of the Jamaica Logistics Hub. Watch this feature, which brings further clarity to the objectives of the initiative by the Ministry of Industry, Investment and Commerce.
Jamaica, the brand on the lips of the world, friendly faces, exciting places, rich culture, salubrious climate, great food, blue mountains and white sand beaches intertwined with modern amenities and infrastructure creates a quality of life that's unsurpassed as a location for doing the business of global logistics. And the next big thing in the global supply chain, Jamaica is the future home of the fourth global logistics hub, an integral part of the global trading system, facilitating global logistics. That is the movement of goods, persons, and data around the world. It will complement and complete the global supply chain and operate on the scale of the existing hubs, Rotterdam, Singapore, and Dubai. Logistics services have always existed to get products from producer to consumers. The difference today is that producers and consumers are dispersed across the globe. The continuing evolution of international trade has resulted in noticeable shifts in the major maritime and aviation trade corridors. The expansion of the Panama Canal in 2015 will lead to substantial redeployment of maritime traffic. Jamaica, with its prime geostrategic location, sits at the doorway of the Panama Canal, at the convergence of global trade corridors with easy air and sea access to major markets. The Jamaica Logistics Hub initiative will be an ideal location for global commerce and is attracting a wide range of producers and distributors from different countries, which will derive considerable benefits from enhanced logistics services. Jamaica gives global businesses easy access to an 800 million person market in the Americas with reduced delivery times, which enhances global trade. A global asset serving a global economy. Whether your businesses have in-house or outsourced logistics services, we invite you to leverage the speed and connectivity of Jamaica's Logistics Hub to get products to market quickly and grow your business. In addition, the expedited shipment of goods will result in reduced cost for your company and the end user. In addition to the existing infrastructure, new special economic zones, free zones, and logistics parks are being established with competitive tax regime options. This will provide a conducive business and living environment with easy access to North, Central, and South American markets. The ultimate aim of Jamaica's Logistics Hub initiative is to cluster global third-party logistics providers along with some of the largest global businesses. These industrial clusters, consisting of large, medium, and small enterprises, will operate from special economic zones and industrial parks spread across the country. For the manufacturer, the hub provides an opportunity for assembly and other value-added processes. Manufacturers and third-party logistics providers alike will utilize the world's leading airlines and shipping lines operating from world-class ports and airports, thereby allowing sea-to-sea, sea-to-air, and air-to-air connectivity to global markets. Jamaica is also well integrated into global telecommunication networks and boasts the only 3-tier data center in the region, facilitating digital processing and quality management systems. Tremendous opportunities await your business. The Jamaica Logistics Hub is ready to help you move products, people, services, and data into growing markets. A great place to do business, a great place to live, a great place to raise families. The third largest English-speaking country in the Western Hemisphere, with a well-trained workforce and a legislative and policy framework which support the business environment.
The Logistics Hub initiative will transform the Jamaican economy and further integrate Jamaica into the global economy. The hub means wealth creation, jobs and business opportunities for our country. Every Jamaican stands to benefit. That means you, your children, and your community.
The Jamaica Logistics Hub, ready to efficiently take your business to new and existing markets with the power of speed and connectivity. Jamaica is ready. Are you?
Bamboo growers, companies involved in the manufacturing of bamboo products. Get registered with the Bureau of Standards Jamaica. The BSJ is a member of the International Network for Bamboo and Rattan, and the government of Jamaica wants to develop a standard-led bamboo industry that could lead to job creation and economic growth. Companies, your products could be stamped with the regionally recognized Jamaica-made mark certification and the National Certification Mark. Get registered and receive quality training and international certification. For more information, call the Bureau's Special Projects Department at 926-3140 or visit the BSJ at 6 Winchester Road, Kingston 10.
This is my appeal, Jamaica. Give blood for it.
Give blood and give the gift of life. So safe you don't have to think twice. Do what you can for one another.
Yeah, man.
Be a hero, be a blood donor.
Yeah, me people. Watch it. Give blood. For your sister and your brother, save the life of another. You might never know.
Give blood.
As you know, a life you love, many people want blood. The Father says so.
One
Sign up today. Be a blood donor. Many people. One blood.
A few months ago, the government took a bold decision to place a ban on smoking in specified public places. The policy was met with some criticism, but the administration stood firm and the ban remained in effect. 3 months after the imposition of the policy, the country is already a healthier environment, with research showing a 20% reduction in asthmatic admissions to hospitals. Minister of Health Dr. Fenton Ferguson is back with us this week on Issues and Answers. He provides more details on aspects of the policy that will be rolled out in coming weeks, as well as other developmental matters within the ministry.
Thanks for joining us for Issues and Answers. I'm Ian Boyne. Today we speak to the Minister of Health, the Honorable Dr. Fenton Ferguson. The health issues are so crucial, and we know that that's an issue that is on your mind, because all of us has to deal with that issue. We're very happy that the Minister is back to speak with us on that. Minister, always good to talk to you. How has the anti-smoking campaign been going? We know you came under some pressure at first, but you stuck to your guns, as it were.
Well,
kept plugging away.
What is happening now, the Human Resource and Social Development Committee of Parliament have had some deliberations. There's a subcommittee of Cabinet, and I'm awaiting that report, so that we have had about probably close to 30 other interventions since the promulgation on July 15th. Our own expectations is that we will do some tweaking. One of the things that we have been very clear about is that we must protect the health objectives of the regulations. There are other things like the custodial sentence and the level of fines and so forth. We are yielding as it relates to smoking in homes, although we are going to be ramping up the public education, because remember, your children, your helper.
Yes.
You know, because the question of workers, remember, you know, these regulations were put in place to protect workers, children, non-smokers, and smokers themselves. So, and I've had letters from the householders
Household
domestic
Helpers Association.
Association,
They are workers too.
which is a good number of persons, and so you can't ignore it. But where we are now, I am of the view that by the end of November we should bring closure to this thing. It is good for Jamaica. Already we are seeing the ISA Trust Foundation that they have come sometime 2-3 times a year, but they have been keeping data. This year they have seen a 20% reduction in the number of asthmatic cases versus the last 2-3 years. And it's clearly, you know, tied to the regulations.
And quite apart from the law, Minister, it seems that there has been a change in practice, that even though that people are more aware of the not just the danger of smoking, but of the prohibition.
Yes.
So even when people might not be fearful of being locked up, they are more conscious now that they shouldn't light up in certain places. And that's a big success.
And that is what we want. I am on.
If you had that, you don't even need legislation.
As it relates to smoking in enclosed places. That is non-negotiable.
Non-negotiable.
After that, we are seeing now where in some instances it is almost becoming like an antisocial behavior.
That is the point.
I've been told of persons being at functions, start to smoke, and without even anybody say anything, people just look at them.
Of course.
Steer. And within minutes.
That's the power of what you've done. Yes.
So we want the citizens to police the process more so than the police themselves. And that is one of the things I say. It is good for Jamaica, and I believe based on the other countries, Jamaica was the 45th country globally to have had these regulations, the 4th in the Caribbean, and we look forward, not just to the asthmatics, but we're looking forward in another couple of years, less heart attack, less stroke, and with the non-communicable diseases, which is the high blood pressure, the diabetes, the cancers, etc. Over 70% of Jamaican deaths annually is from the NCDs, and cancer is one big player. But cigarette smoking causes not just lung cancer, all different types of cancer. And what I'm attacking with the tobacco control is really one of the critical risk factors. There are 4 critical risk factors: inadequate diet, you know, or poor diet, physical inactivity, excessive use of alcohol, and tobacco use. So we're going to move gradually along the way, but I can tell you, years to come, our people will call us blessed.
We'll take a break at this point. When we come back, we'll talk about infrastructural developments as well as plans for KPH and the St. Anne's Bay Hospital. We know that there are particular concerns about those hospitals. The Minister will deal with that when we come back from the short break.
God, you know, I didn't want to ask you this question a long time. Do you have a JADET card? You know, if you have a JADET card, it can save lots of money when you go to the pharmacy.
Man, certainly, man. I have my own JADET card, man. I've had it for quite some time now. That's helped me tremendously with my health condition.
That's nice.
Senior citizens on the Jamaica Drug for the Elderly program. Take your card to participating government or private pharmacies that display the JADEP sign. Then collect your monthly supply of approved drugs for the chronic illnesses covered by the program. To know more, call the toll-free number 1-888-GO-JADEP. That's 1-888-465-2337.
Welcome back. We're speaking to the Minister of Health, Dr. Fenton Ferguson. Yes, Minister, there have been a couple of letters in the press about the St. Ansby Hospital, but quite apart from the issues to do with customer service, things seem to be pretty run down there at St. Ansby Hospital. Is the government doing nothing at all?
Well, put it this way. You know, it is amazing about St. Ansby Hospital. I remember last year, I think it would have been November, when I visited St. Ansby Hospital, the complaints that came from accident and emergency area was flooding out, poor air condition in unit, the female medical ward, because they needed a new female medical ward, because that was part of the problem why the accident and emergency area was becoming a parking lot.
Yes.
They had great concerns about the throughput relative to operating time in terms of theater, etc. They had issues related to ambulance. What have happened? What have I done since November last year? We put a brand new air conditioning unit at a cost of $10 million. So that flooding and the question of patients being hot and all those issues, we have solved that. We have not been able to move persons out of the accident and emergency as we wanted. But what have I done? We have broken grounds far advanced. I'm looking to open a brand new female medical ward at St. Ansby Hospital by about January of 2014, spending $74 million. What else have I done? We have broken ground to build 2 new operating theater to improve the throughput. That is going to, at the end of that project, that's an additional $140 million.
About when you think that might be completed?
That one, I believe, should be completed about March, April.
Okay.
It's somewhere there, because it's going now. There was a Jamaican visiting for holidays and had an issue, and had to go to St. Ansby Hospital. She went back up to London, fundraise. They got 2 ambulances. But I just gave them another brand new. Since 2007, no ambulances were brought in. I just brought in 19 ambulances. 19? So KPH got, St. Ansby got, Anata Bay, Port Antonio, Princess Margaret, right across the country, almost every hospital. And I'm going to be bringing in between 10 and 12 ambulances every year. Before the end of this financial year, I'm bringing in another 10. And each year until we get to the numbers that we believe is adequate. There are some concerns in our sector, not just St. Ansby, right across the country relative to the human resource element. There are some concerns about customer service. There are some concerns because we are still pursuing the no user fee policy, which, as you know, when I was in opposition, I was strident that we needed to review. When I started looking at the user fee versus no user fee, I came to the conclusion now as minister that the outcome of that, even if it's user fee, you still have major challenges in terms of sustaining the sector. The university hospital has user fee. They have issues. They have problems. So I have completed 8 consultations on the options for health financing. My intention is that by 2015, we should be moving towards universal health coverage, a possible national health insurance. A lot of that work has been done. I am taking on the focus. It is what is being spoken about at the Pan American Health Organization, at the World Health Assembly, and there are a number of countries that have moved towards universal health care. And I am adamant that Jamaica must move to that status. The question of, and we're not saying in going forward, between now and then, that user fees might not be an option. But this year, with the tobacco, I took a decision. We didn't want to bring back the user fee because we were looking at increasing utilities. We were looking at increasing bus fare and transportation. So I took that decision.
Yes, I agree with you.
Right?
The country agrees with you.
And therefore, what we want is a sustainable health system. That is my ambition, that's my goal. And that is why we are going to see some game changers in the health sector. Yes. Before the end of this financial year, you will see a movement from the Ministry of Health itself to the National Health Fund, a takeover of the pharmaceutical services, which will be a major game changer. Yes. You're going to see a GOJ unique card that health clients or patients will have. Yes. That will be tied into their TRN number. Yes. And will have persons who are on PAD program. It will have persons who are private insurance. So you're not going to depend on a person's honesty to say I have health insurance. A swipe will determine that. One of the big things that card would also help us to see what the health budget ought to be, because now you would be able to see the different procedures and putting a cost to it. You'll have a better feel for budget as to how you go forward.
Big game changer.
Right? So that is going to be a game changer. Cancer care, which you know is my big ideas project. Before we are expecting to break ground and to put in place 2 linear accelerator machines in the public sector. There's only one in the country now in the private sector. And in the private sector, if there's a normal patient, it's about 1.5 to 1.7 for the full course of treatment for radiation. Yes. We are saying we have 2 old Cobalt 60 machines for radiation in the public sector. We are moving to bring in place the Linac machine, which is the state of the art, right? And we intend, there's going to be public-private partnership arrangements too in going forward. Chase Fund will also be a major player in all of this. But that will make some difference. KPH, you made mention of.
Yes, just half
relative to the cancer program, we have put in place a 18-seat chemotherapy. We have cut the waiting time now by 50%. KPH. We're going to be doing some work and getting some private partnership with the accident and emergency area. We have painted the wards. If you go, you see improvement in wards. Yes. There are persons who knock KPH, but when there's problems in the private hospital, it's KPH or where they go. Yes. We have some of the best doctors, best nurses. KPH. But again, we have to get back to the kind of citizens charter, the kind of, things that we're going to do, customer care, patient care that involve the good social behavior and recognize that our patients
so much
critical.
Sometime soon we have to bring you back. There's so much happening under your portfolio. Minister of Health, Dr. Fenton Ferguson, tell us about the exciting things taking place in the health sector. Next week I'll be back. Until then, Ian Boyd wishing you a pleasant day.
It's said to be the hardest job, being a parent, and there are no precise instructions on how to be successful at this all-important job. Most do their best and follow tried and proven principles passed down by the older generation. This National Parent Month, let's provide support to caregivers. Let's reintegrate that culture of it takes a village to raise a child. If you need more support, try the recently launched National Parenting Support Commission or the National Parent Teachers. In the meantime, if you can, attend at least one of the activities planned for celebrating parents all month long. A highlight is the National Assembly of Parents at the school their children attend, planned for Friday, November 29. Let's support the hardest working individuals within our society as we strive to achieve national developed status by 2030. As we celebrate Eat Jamaican Month, we leave you with this quote. We need to stop and check what is in our food baskets. We all need to check what we are growing in our backyard gardens. We all need to check what our young people and children are consuming as snacks. Words of Minister of Agriculture and Fisheries, Roger Clark, in his bid to encourage more consumers to purchase local products. That's how we end our program for today, but do join us again tomorrow on the station for another interesting package. We'd love to hear from you, so send us a tweet at JIS News or send an email to jamaicamagazine@jis.gov.jm. Be sure to click on our homepage, jis.gov.jm, to get the latest information on matters of development. On behalf of the entire team here at the JIS, I'm Adrian Atkinson. Do take care.
This has been a production of the Jamaica Information Service, the voice of Jamaica.